marketing products as nitric oxide that are not nitric oxide, could destroy the entire nitric oxide field. And the future of medicine is dependent upon nitric oxide. So, that's my daily kind of, well, it's not just frustration, but it's my objective is how do we educate and inform on the actual science of nitric oxide so that people who are watching TV, hearing commercials and seeing these fraudulent, deceptive advertisings understand that those products don't work and understand that they don't work because they can't work.
Hello, and welcome to Legends of Longevity with me, Joseph Entz. I'm your host, and I'm thrilled to have you join me on this journey towards living a longer, stronger, and more vibrant life. The podcast is about uncovering the secrets to longevity, things your doctor does not tell you, whether it's groundbreaking advancements in heart health, lifestyle tips to keep you thriving, or inspired stories of people who've defied the odds. Together, we'll explore the tools, techniques, and mindset shifts that can help you unlock your fullest potential. Whether you're here to learn how to enhance your well-being, support your loved ones, or just stay ahead of the curve in health and wellness, you're in the right place. Let's empower each other to not only live longer, but live stronger. Welcome to Longevity, Legends of Longevity with Joseph Entz. Today, I've got a real fun, special guest. This is the kind of career you wish your kid could figure out. So Dr. Nathan Bryan is world famous for nitric oxide. And a little bit about his history is he was a professor. He thought this molecule was fascinating and he put out the research. And I saw him at trade shows. I saw him working it, talking to doctors, telling about the science, how it can help men for exercise or reproduction, the nitric oxide. And it's turned into a whole universe. Many other companies are now adding in supplements to boost the nitric oxide. Anyway, somewhere around 2010, 2014, you said to me at a conference, dude, I've got a contract with farmers years in advance to get the right amount of beets. And I thought, this dude's selling beet powder and crushing it. Wow. So that was 10 years ago. He's since been to many conferences, speaks all over. He got a professorship and then went rogue and went into the business world. So please welcome Dr. Nathan Bryan, very interesting man who has tools in his head to make money, save lives, and help people help themselves, which I think is the highest calling. Welcome, doctor.
Thank you, Joseph. Great to see you. Wow, what an introduction.
Doctor or professor? What should we go with?
Either. You're not going to hurt my feelings either way. I've been called a lot worse.
Did I nail that story pretty good?
Yeah, no. It's good to get these reminders of, you look back and just any life, any career is a journey, but it's certainly been an interesting journey for me.
So the reason I've been trying to get a hold of you the last couple of years is to ask you about your marketing. So medicine's a little bit broken, and getting people to pay cash for supplements and food that are healthy and letting doctors know about it. And if you don't have a pharma budget, it's very difficult. And a pharma budget is huge. And so you need to rely on real things with real education and real science. So how was that for you? Or what were your business-wise, how did that go?
Look, business is tough. The thing that makes people successful is to differentiate yourself from the competitors. And the definition of marketing is just be different. We've done very well at that because our product technology is based on my 25 years of research, discoveries, innovations, some seminal discoveries in the field that changed the way we thought about nitric oxide. And so, as you said, I created this market in the supplement space, about 20 years ago when we first had these discoveries. And now, as you mentioned, all these companies, there's hundreds of companies out there selling hundreds of so-called nitric oxide products, and it's creating mass confusion. And it's really, has the potential to kill the entire industry because these companies out there marketing products as nitric oxide that are not nitric oxide, could destroy the entire nitric oxide field. And the future of medicine is dependent upon nitric oxide. So, that's my daily kind of, well, it's not just frustration, but it's my objective is how do we educate and inform on the actual science of nitric oxide so that people who are watching TV, hearing commercials and seeing these fraudulent, deceptive advertisings understand that those products don't work and understand that they don't work because they can't work. because these companies don't understand the science, the biochemistry, and the physiology of nitric oxide, which is what I've spent the past 30 years understanding. So that's been our secret to success, is leading with the science. These discoveries we made are fundamental truths. And so with truth on your side, and you go out and you speak the truth and speak the gospel, then people, it resonates with people. And not only do we,
Where did you find a receptive audience?
that's been an evolution as well, because coming from the academic world, where I taught in medical schools, interacted with other professionals and physicians and professors and researchers, we thought, okay, well, let's go out and educate doctors and get doctors on board with nitric oxide so they can understand that nitric oxide deficiency may be contributing to their patient's symptoms or underlying disease, and then start to incorporate nitric oxide based product technology or lifestyle diet strategies. It'll change the course of their patients. But you brought it up in the introduction. We're conditioned by Big Pharma and by the American Medical Association that if you can't test it, it's not important. And if it's not reimbursable, it's not part of the standard of care. And so supplements, sometimes simple therapeutic solutions, aren't reimbursable. And so, we realize it's hard to teach new dogs new tricks. This isn't taught in medical school. So trying to teach physicians this new way of medicine is a very difficult task. And it's not what we call the standard of care. And so doctors typically don't venture outside the standard of care for obvious reasons. But I think now what we're seeing is we're seeing really a revolution in medicine, because what we're realizing is that Western medicine today is not working. America is the most industrialized, advanced nation in the world, and we have the sickest people on the planet. So it's obvious that the way we're doing things isn't working. Medicine isn't making anybody better. We have to get back to root cause, and that's what I've focused on for the past 25 years. And that's what led me into science and medicine, to understand the mechanism of disease to the extent that you can develop novel therapies, or what we call restorative physiology, to address root cause disease. And that's the future, and that's where we're headed. But, there's a lot of resistance to what we're doing.
So when you say medicine is not really responding, or it's hard to get them to change, we've decided that there's like two pathways in medicine, and there's lots of flavors of it too. So you've got your longevity docs, your functional medicine docs, and if you're going to a doctor where you get a 10-minute appointment, you're probably going to get a prescription. You're not going to get much guidance. You may get a little sympathy, but you're out the door with a prescription. And a whole new breed of physicians are popping up in these little shops, and they're offering dietary training and supplements and nutraceuticals and peptides and all the things that the medical system does not allow.
Yeah, they don't allow it because it makes people better. and once I think
it's true. It's sad.
That was an epiphany for me, because in medical school we're teaching future physicians not just the basic sciences, the biochemistry, the physiology, and anatomy. Then they learn pharmacology, and they go out and do clinical rotations and figure out what the actual practice of medicine is. But you can't forget, medicine is a for-profit business. And just like any other for-profit business, their number one objective is to gain as many customers as you can and keep those customers for as long as you can. And it's the absolute best business model in the world. They're participating in a $1 trillion global industry, and they're the absolute best at getting patients on this hamster wheel on one medication, two medications. You look up, you're 50, 60 years old, and you've got a customer that's on 12 of your products. It's a great financial model, but it's the worst model for the American health that exists. And so we have to do better, and we can do better, because the science tells us that people get sick for two reasons and two reasons only. Their body's missing something that it needs, or it's exposed to something that it doesn't need. And if you replete missing nutrients and you eliminate the source of exposure or toxins in the body, the human body heals itself. That's how we were designed. And so when you start to incorporate that paradigm into patient practice, there is no room for pharmaceutical drugs, because pharmaceutical drugs are synthetic compounds that inhibit biochemical reactions. And that's part of the problem, actually, because you're exposed to something that the body doesn't need.
How many celebrity physicians do you know of that went to medical school or quit halfway through and now they're famous because they rejected the medicine message? There's a few out there.
No, there are, and some of them are in this administration, and they've come under scrutiny. But when we look at and if you want to implement change, you've got to bring change-driven people or change-minded people into the administration or into any organization. You can't have these people that have been in the swamp and been part of the problem for their entire career, 40, 50 years in politics, and expect new change to occur. You've got to bring in new blood. We need a new blood infusion or transfusion, and that's how you implement change.
Have you read RFK Jr.'s book, The Real Anthony Fauci, talking about the vaccines? I'm sure you know about a lot of it.
No, yeah, I haven't read the book, but I'm certainly aware of the evil and the criminal organization that we were exposed.
He's not acting like the guy who wrote that book, which is crazy to me. I'm glad he's getting rid of the red dye number 40 and a bunch of stuff like that. But he's not. I mean, thimerosal, that's a pretty good one actually. But it's not from what he wrote in his book. The way he's acting, it's very different.
Violent opposition to change because it changes the whole economic model of the world.
The inertia is changing. Yeah, you're right.
The inertia is changing, but it doesn't happen overnight, and it takes time because you have to slowly make these changes. You just can't, it would topple the world economy. We have to slowly make these changes. And two, you have to lead with science, and that's what the science is telling us, especially if you look back over the past 4 to 5 years. The science is very revealing on what went wrong, and I don't think Americans are going to fall for those lies anymore.
How do you feel about, we're talking about research that's bunk, and I was just telling someone I used to believe the whole cholesterol narrative. I taught people it, I studied it, I believed in it, and now it's kind of fallen apart. How would you describe that whole rigmarole?
I think it's probably one of the biggest myths ever perpetuated in medical science because cholesterol doesn't cause heart disease. Targeting cholesterol can't affect heart disease. And all you have to do is look back at the numbers. These drugs were approved in the late 80s. The cholesterol-lowering medications, the statins, we call them HMG-CoA reductase inhibitors. They inhibit the rate-limiting step in endogenous cholesterol production. Our body makes cholesterol. Why does our body make cholesterol? Because our body needs cholesterol. We can't inhibit it. And so in the 1980s, when these drugs were first approved, the American Heart Association were so bold, saying, treating patients with cholesterol-lowering medication will completely eradicate cardiovascular disease and percutaneous coronary interventions by the turn of the century. So that was the 1980s. And if you look back historically at the data, and all you have to do is look at the numbers. Back in about a 4 to 5 year period, there were about 11 to 1,200 PCIs, which are basically stents, angiograms, diagnostic angiograms, stents you put in coronary arteries that are obstructed or occluded from plaque. So when you start cholesterol-lowering medication, and now you look over the past, now that's been 30, 40 years now, almost 40 years, we're doing about 1,500 PCIs per year. So we were doing 200 to 300 a year. Now it's about 1,500 a year. So it's 5x increase. And we know that cardiovascular disease is still the number one killer of men and women worldwide. It hasn't changed. It's going up. So the data are very clear. Treating people for lowering their cholesterol has not made anybody better. In fact, it's made people worse. These are mitochondrial toxicants. They're causing diabetes. They're causing certain types of cancers. They're causing myalgia, depleting certain nutrients like coenzyme Q10. And when you look at the risk-benefit, which is what everybody should look at, what's the benefit of taking this medication and what's at what risk? And today the data clearly show that whether it's primary, secondary, tertiary prevention trials in hundreds of thousands of patients, there's no benefit for cholesterol-lowering medication. Okay, if there's no benefit, then what's the risk? Diabetes, muscle pain, cramps, certain cancers.
A lot of people swear Alzheimer's.
If there's no benefit and it's all risk, why in the hell? Yeah, Alzheimer's. Why in the hell are we still prescribing these medications? It's
the momentum
makes no sense.
is so strong.
The data are very clear.
Yeah, and it's amazing to me. I had this experience a couple weeks ago. I won't name this gal because she was so embarrassed, but she was an ultrasound tech in the hospital, and she believed all the hospital research and blah blah blah. And so it's her first foray outside of the hospital, and we go to some doctor's offices, and she started making fun of me about vaccines because I'm kind of down on COVID. There's a lot of mysterious, not so cool things with it. And she's like, I can't believe you don't do vaccine. I can't believe you're down on. Blah, blah, blah. So we go to the first clinic, and all I did was say to the doctor, she believes in vaccines. And the doc's like, oh, you're bless your little soul. I'm so sorry. You'll come around. It's the first time she ever caught resistance on it. So we do 3 more visits, and I just kept throwing her under the bus. And the doc would have the same reaction like, well, you don't want to get all the vaccines, or you want to be judicious. Hep B for babies is not super necessary. And it was pretty cool because seeing someone come out of the system, their thought pattern was solid, and then coming into a new system, like, wait a minute, these guys don't believe the same things I do. And that's everywhere in medicine right now. If you're in a hospital system, you definitely believe and get bonused on the amount of vaccinations you do. And if you're outside the system, you're managing for success and health.
Well, you have to be objective. Anybody with objectivity that's not influenced by the organization in which they work under, you can't help but question everything about medicine. Question the judicious and safe use of any vaccine. Because the data are very clear. They provide no benefit, and they're deadly. And for me...
No, thank you. And back to the statins. I once, they use numbers to treat on how many people you got to prescribe to save one life. And for a baby aspirin, I think it's like 1 in 800. And a statin is like 1 in 600 or high 500s. So you got to give 500 people this lifetime drug to save one life. Those aren't the best odds, my man.
No, look, that's people who don't understand biostatistics. They just read the headlines. And the way that the biostatisticians fool people and grab headlines is through a made-up number called relative risk. It's not the absolute risk. What's the absolute risk reduction versus the relative risk? And part of that algorithm is the number to treat. And so what they do, if you take so let's take 100,000 people, and you treat one with a cholesterol-lowering medication, the other with a placebo. And out of those 100,000 people, let's say 50,000 in the control group had a heart attack. And then 60,000 or 51,000 had a heart attack in the treatment group. So what they do, they take that extra 1,000, which is an absolute risk, and they took a relative risk, and it makes it like, okay, now we've got a 20% improvement or relative risk reduction in heart attack by lowering that. But if you've got to treat 100,000 patients to see one benefit, then the number to treat becomes an issue, and then the absolute risk becomes an issue. And I may have screwed up the absolute numbers on there, but the point is that inherent in statistics is an absolute risk and a number to treat to be able to see benefit in one patient. But you never see that in the headlines. All you see is a 20% risk reduction with this medication. But what they don't tell you, you'd have to treat 1 million patients to see that one benefit, and it's really not an absolute risk reduction at all.
No, it's not the truth. And I remember stats in college to feel bad for the man who drowned in a river with an average depth of 1 inch. Like, there's still pockets of bad. There's still, you got to be careful on the stats because these guys, they're professionals. All day they think about it. How can I spin this so it sounds really productive for the patients and doctors? And they have whole teams of people doing on it.
That's how relative risk came up. Yeah. How do we make these numbers look good when they're not good?
Yeah. Fascinating. All right. You told me some things about nitric oxide that I wanted to dig into a little bit. You told me that there's some supplements out there that are only effective for 10% of the population for boosting your nitric oxide. Tell me more about that.
So when we look at the supplement market, there's kind of 2 classes of nitric oxide products that are marketed as nitric oxide. You've got your products that are sold in capsules or tablets that contain arginine or citrulline. And we're never deficient in arginine or citrulline because these amino acids are made through the partial urea cycle, and they're constituent amino acids of many proteins, both animal and plant proteins. So we're never deficient in these. So supplements are meant to supplement what we're deficient in. We're never deficient in arginine or citrulline, so there's no need to supplement. And 2, the problem with nitric oxide deficiency is that the enzyme that converts arginine to nitric oxide is dysfunctional. So giving arginine is not going to fix the enzyme. That's why these products don't work. And so I tell people that's an easy litmus test. If you're buying a product that has arginine or citrulline in it, then that's an easy litmus test that these companies making these products have no idea about the biochemistry and the enzymology of nitric oxide production. So just don't buy from them because they don't know what they're doing. Then the other kind of class of products are the beet products, the beet powders, and then what we call nitrate. And there's companies selling potassium nitrate in a capsule. But then, again, they don't understand the science because potassium nitrate is inert in humans. Humans cannot metabolize this molecule. It's dependent upon the bacteria that live in the oral cavity in our digestive system. So if you don't have the right oral bacteria, you take a nitrate capsule or you take a beet product that has nitrate in it, and it just goes through the digestive system unchanged. You pee it out, you poop it out, and you sweat it out as inorganic nitrate. And now it's okay, so what
Tell me what a nitrate is again, just so I have it.
nitrate is just inorganic nitrate is a molecule that's naturally occurring. It's found in the soil. It's NO3 minus. Companies, there's salts of it. You can manufacture it, either sodium salt or potassium salt. Most people are using potassium nitrate.
All right, so on my cured meats, they're like, those are high in nitrates, and that's not necessarily good for you.
Yeah, well, the cured meats are cured with nitrite, sodium nitrite, or they use cultured celery extract, which is nitrate. They put a starter culture of bacteria that reduce the nitrate to nitrite, and then it's nitrite that binds to the heme iron of myoglobin that forms this nitrosyl chrome, nitrosyl heme pigment, that then leads to the curing of meat. So that's the chemistry that we've understood now for, hundreds of years in meat curing, even long before refrigeration, thousands of years.
Right, right. But back to the beet powders that have the nitrates.
Now, that's the problem. 95% of the beet products out there, most of the beet products on the market, contain no nitrate at all and no nitrite. And again, that's companies because they don't understand what they're doing. They say, oh, well, we'll put beets in this product and we'll, buy the cheapest beet powder out there. We'll put it in a chew or a gummy or a capsule and we'll call it nitric oxide. Well, they don't understand. When you take beets, when you harvest them from the field, you bring them in, we create what's called a high Brix concentrate, which is almost like a molasses type substance. And then you've got to dry it and make it into a powder. So what they do, they put it into high heat, high pressure, and nitrate is water soluble. So the nitrate comes out in the drying process. So there's no nitrate in any of these beet powders. So not only is it misleading because these companies don't understand that beets are not nitrate, and nitrate is not nitric oxide, they missed the boat. But let's just assume that there's nitrate in the beets or there's nitrate in these capsules. The way this entire process works is when you swallow this, it goes through the stomach, we have gastric emptying, the nitrate is absorbed in the duodenum, the proximal gut, and from there it's concentrated in our salivary glands. And this takes about 90 minutes from the time you swallow that capsule or take beets till it's recirculating your salivary glands. So now we salivate and we excrete nitrate or secrete nitrate. Then there's nitrate reducing bacteria, if you have the right bacteria, that perform this 2-electron reduction of nitrate to nitrite. So now we have saliva that's enriched in nitrite. We swallow that saliva, it reaches the acid environment of the stomach, and we produce nitric oxide gas. That is how the system is designed.
It's a 2-pass system, huh?
No, it's 3. You got to have a certain amount of nitrate, you got to have the right oral bacteria, and you got to have stomach acid.
All right.
And most of these products aren't accounting for they're not accounting for any of the 3. But let's just assume you have nitrate. Almost 73% of the municipalities in the U.S. have fluoride in their drinking water. So every time you drink water, cook water, bathe in water, you're completely destroying the microbiome, the bacteria that live in and on your body.
The fluoride's a bactericide?
Of course, that's why they put it in the drinking water. That's why they put it in the toothpaste.
I thought it was to calcify my third eye.
No, it's a neurotoxin too. And it shuts down your thyroid function. I mean, fluoride...
Doesn't it make kids 10 points dumber on their IQ test? I read that.
That's exactly right. After 7 points, it lowers IQ by as much as 7 to 10 points in kids. I mean, why are we putting this in drinking water? Why are we putting it in...
We need to hang some people. People need to hang high for stuff like this.
For sure. I mean, we know better, right? I mean, again, risk-benefit. There's no benefit with enormous risk.
My teeth are falling apart, and I did all the fluoride treatments, and dude, what a scam.
Yeah. We have to do better. We're finally educating and informing the dental community, and now there's obviously a movement to get fluoride out of drinking water.
They did it in Utah, and I think a bunch of counties are actually following that. This year, it's been really good momentum on getting rid of the toxic fluoride.
Yeah, and look, finally, there's common sense coming into public policy, and it's refreshing to see because you can't ignore the science. The science is very clear.
Yeah, but the pendulum's swinging so far that it seems like it was on purpose that it was that bad before.
No, if I wanted to make you sick and chronically dependent upon pharmaceuticals, I would get your cholesterol below 200. I would put fluoride in the drinking water to cause complete dysbiosis, gut dysbiosis, oral dysbiosis. If you were admitted to the hospital, I would put you on a proton pump inhibitor to completely inhibit stomach acid production, so you can absorb basic nutrients like B vitamins, calcium, iron, selenium, chromium, iodine, so you become nutrient deficient. And I would, send you to a dentist and perform root canals. And I would follow the advice of the food pyramid in the U.S. That is the best recipe.
Don't forget the corn syrup and seed oils.
Yeah, and put everybody on a high carbohydrate diet with limited red meat, right? You gotta
Limited
don't eat a lot of.
and deep fry everything in a former engine lubricant, cottonseed oil. That's what we should do.
Yeah, that's right. That's right.
Yeah, you would have to believe it's choreographed
Creating a sick population.
because there's so many things bad in a row sequentially. You're like, wow. And to get out of that system is very difficult. It takes education.
No, it creates the perfect customer. It is the perfect customer for Big Pharma. And that's why they've made so much money at the expense of the health of people all around the world. But again, at the end of the day, science prevails because you cannot ignore data. You cannot ignore prospective long-term outcome studies. And we know mechanistically what's making people sick. So we have to correct the old ways because there's a better way out there, and it's proven scientifically, it's proven clinically.
You were also telling me about other ways to get the nitric oxide in the body beyond the beet powder, I think a couple days ago. Was that different from the process we just described?
No, I mean, look, there's nitric oxide's a gas, and I think that's important for your listeners to understand. This is a gas that once it's produced, it's gone in less than a second. So nitric oxide is not something you can chew on. It's not a pill you can swallow. We have to make it, and we have to restore the body's ability to naturally make it. So, through my 25 years in academia and making a number of discoveries, in 2007 we published that nitric oxide is actually a hormone. And that was a Proceedings National Academy of Science paper where they completely changed the paradigm on nitric oxide. So just like estrogen or testosterone, if you're a man that has low testosterone and you go to an endocrinologist or a doc, he doesn't put you on a precursor to testosterone and hope your body can make testosterone out of it. Right? He gives you testosterone. Same thing with women, perimenopausal, postmenopausal women. If they can't make estrogen, we give you estrogen. They wouldn't give you pregnenolone or DHEA and hope your body can make these sex hormones out of it. That would laugh. But that's what these companies are doing with nitric oxide. And why? Because they don't understand how the human body makes nitric oxide. They don't understand what leads to a loss of its natural production. So if you don't understand that, you really have no business making nitric oxide products. People are wasting their money. It's not making them better. And in some cases, it's actually making them worse. So the thing that we do that's different than any other company in the world is if your body can't make nitric oxide, then we do it for you. We're giving you this molecule. We do it through an orally disintegrating tablet. I'll show you how this works. But I just developed this lozenge, it's an ODT, an orally disintegrating tablet. You put this in your mouth, and over 5 to 6 minutes, this matrix is going to fall apart. And as it's falling apart, we're producing about 20 parts per million nitric oxide gas. Now, some people on here, if they've had premature babies born with pulmonary hypertension, as soon as they're born, they go to a neonatal intensive care unit, and they give them nitric oxide gas through a nasal cannula. 20 parts per million. It dilates the pulmonary arteries, it reduces pulmonary pressures, it matches ventilation to perfusion. It's saved millions of babies' lives since the late 80s, early 90s. But the only way to deliver that is through a gas, inhalative nitric oxide therapy. So this here, I've made a solid dose form of that nitric oxide gas. Same amount, 20 parts per million, being produced right now in my oral cavity. It's a gas that diffuses through mucous membranes. It binds to glutathione. It's transported as S-nitrosoglutathione. Within 10 to 12 seconds, so if I had your ultrasound, I could watch my carotid arteries dilate. Within 20 minutes, if my blood pressure was elevated, it would normalize the blood pressure. Within 30 minutes, we start to see an increase in the number of stem cells in circulation. So we've documented the physiological effects of this nitric oxide lozenge over the course of 24, 48 hours, even 6 months, and we're starting to see an improvement in endothelial nitric oxide production, about 20 to 50% improvement in endogenous nitric oxide production within 20 minutes. Looking at things like flow mediated dilatation and pulse wave analysis and venous occlusion plethysmography, all of those bona fide, clinically relevant, validated devices show that this product actually produces nitric oxide gas and improves the body's ability to make it naturally. And because it's residing in the oral cavity, we're killing the pathogenic bacteria and we're improving the diversity of the oral microbiome. So now your body's able to produce nitric oxide more naturally. And that's what we do that nobody else on this planet does. No matter what you hear on TV, no matter what you hear about, we've partnered with all these universities, all these athletes are using it. They do not have the technology that I develop because they don't understand the science. No matter what they say on TV, on podcast, they don't know what they're doing.
All right, we're getting closer to me understanding this, but I got to come from a reference point that I understand. 10, 15 years ago, I started weightlifting. I stopped a long time ago, but back then, your creatine, your protein, but they had these NOS pills, nitric oxide pills. And once or twice I took that, and man, that amped me up. I could lift more. It was great. But after a while, they kind of stopped working, and I stopped taking them. But a lot of guys believe in those. How is that different from the nitric oxide? And we're going to talk about why people would want to take this in a minute, because that's important. But how's what I got at the gym bro stuff, different from what you're pumping out?
Well, they're putting a lot of ingredients in there. Number one is it's caffeine. And a lot of these companies have reached out to me and wanted me to help improve their pre-workout, their so-called nitric oxide pre-workout. And I go, well, first of all, you got to take the caffeine out of it because caffeine's a vasoconstrictor. So even if your product was producing nitric oxide, the vasoconstrictive effects of caffeine, they go, look, Nathan, we've tried that. But if we take the caffeine out, then the product doesn't work. And I go, there's your answer. You don't have a nitric oxide pre-workout. You've got a caffeine pre-workout. And look, the data on caffeine as an ergogenic aid are undeniable. The perceived exertion from caffeine is very well documented. So they're selling a caffeine product as a nitric oxide product. And it's because these companies don't know what they're doing. And look, ignorance is curable. Ignorance is just a lack of knowledge. But stupidity is not curable. And stupidity is knowing the information and not implementing it. And there are a lot of stupid companies out there who know better that are spending millions of dollars on advertising every month saying that they have a beet product that produces nitric oxide when it doesn't. I've tested it. I've tested all these products. And at A4M next week, we're going to be there. I'm going to bring these analytical instruments with me, and we test these products. These companies try to kick me out of the exhibit hall, have the organizers kick me out because I prove that their products don't work, and they don't like it.
Yeah, not all these companies love you, I found out this week. The competitive companies, that's not their bag. They just added it into something else usually, right?
Yeah, because look, there's a lot of good companies out there in the health, wellness, and longevity space that sell a lot of good products. Magnesium is extremely important. Glutathione is important. Creatine, protein, amino acids. But nitric oxide is not something that I can, like vitamin C, I can throw in a capsule and give you vitamin C. Nitric oxide is a completely different monster. It's a gas. It's a complex, complicated science. And if you don't know what you're doing, number one, you can't provide a product that provides any real benefit. Or worse, you could actually do a lot of harm. There's clinical studies out there showing that taking high-dose L-arginine actually can make patients worse. Post-infarct patients, higher morbidity, higher mortality. Patients with peripheral artery disease, they take arginine, they get worse. And then you got companies out there selling beets that don't provide any nitric oxide, so people take these products, they don't get a benefit. Their interpretation, they go, Nathan, nitric oxide doesn't work for me. And I go, what do you mean? They go, I've been taking this beet product, I've been seeing advertising on TV for years because they say it's nitric oxide, but it didn't improve my blood pressure, my energy levels didn't get better, I didn't see any benefit. And I go, no, nitric oxide always works. What doesn't work is that company. What doesn't work is that product, because those products, that company, don't know nitric oxide. Those products don't produce nitric oxide, so of course you didn't get a benefit. And that's the problem. And so, yeah, when I go out and call these companies out and show them that their products don't produce nitric oxide, that it can't produce nitric oxide, and that they're frauding and deceiving their customers, they don't like it. In fact, some companies have sued me. They've sued me personally and sued my companies because we're going out telling the truth, showing our products work, showing their products don't work. They don't like it. They're big companies making a lot of money. They can afford to sue people, and that's what they do. It's a business strategy. It's taught in business school.
You would think the business model would be savvy citizens would sue lying companies for misrepresenting what they're pushing. You would think that would be a productive way to fix this problem, but the companies are on the offense.
Yeah, no, look, that's why it's so important that we get this message out there on the real science of nitric oxide. And if we do our job, if I do my job of educating and informing the mass public, then they'll stop buying from these companies. These companies will go away because, and that's the reason they have to spend so much money on advertising, because the highest cost is acquisition of a customer. You have to spend a lot of money to acquire that customer. In a successful business, once you get that customer, if you got a product that works, they'll continue buying that customer. So you can, get your return on investment from that acquisition. But the reason these companies aren't profitable and spending so much money on advertising is they acquire a customer, they buy that beet product, maybe for 1 or 2 times, they realize it didn't provide benefit from them, they stopped working, stop buying it. So now they got to go out and acquire a new customer to keep growing. And so it's just this vicious cycle, and it's a money trap. And and what we do is we don't spend a whole lot of money on advertising. We just try to educate and inform on nitric oxide. People find our product, they take it, they get a benefit, and they continue to take it. Why? Because it works. They see the benefit, they feel the benefit. And I think over time, when we start to correct the ship and get rid of all these people who are doing deceptive marketing and reveal the true science of nitric oxide, their only solution is going to be our product technology, because we're the only people out there who actually make nitric oxide.
So nitric oxide, you say it's a gas, you say it's a hormone. I know it as the signaling molecule to tell your vessels to get bigger for exercise or reproduction. But what else in the body? Like, why would I take nitric oxide if I'm just, 60 years old, feeling kind of crappy, wish I could feel better? I'd love a little air on the tire for the wife type stuff. Is it good for all those things? Or what are the scenarios where somebody like, I need a self-supplement?
Well, look, if you look at the common denominators of every single chronic disease, there's always reduced blood flow. We call that hypoxia or ischemia. There's always inflammation, oxidative stress, and immune dysfunction. And all of those result from a deficiency of nitric oxide production. So nitric oxide, as you mentioned, is a vasodilator. So if we give nitric oxide, restore the production of nitric oxide, it dilates the blood vessels. Now we're going to get better blood flow, oxygen delivery. It reduces inflammation, inhibits inflammation. In fact, I have a number of issued patents on a method of reducing inflammation. It inhibits the cellular sources of oxidative stress. It shuts down NADPH oxidase. It recouples the electron transport chain to the mitochondria. And it recouples the NOS enzyme, so now we can produce nitric oxide. And then it corrects the immune dysfunction. It's the signal that tells our M2 macrophages to go from, the atherogenic kind of kill phenotype into the anti-atherogenic, anti-inflammatory, heal type M1 macrophages. Can't make nitric oxide. You don't dilate blood vessels. You get runaway inflammation, oxidative stress, and immune dysfunction. Those are the drivers of disease. And we see that we've been able to document each one of those on how our nitric oxide releasing lozenge corrects all 4 of those. But so for me, it's all about circulation, oxygenation. But nitric oxide is more than a vasodilator. It mobilizes stem cells. In fact, it is the signal in our body that tells our own stem cells to mobilize and differentiate. It activates an enzyme called telomerase, which prevents our telomeres from shortening. Shorter telomeres, shorter life. Longer telomeres, longer life. And then it induces mitochondrial biogenesis. Activates PGC1 alpha, tells the cell to make more mitochondria. So the net of improving nitric oxide production is better circulation, more stem cells in circulation, longer telomeres, and more mitochondria per cell, generating more ATP more efficiently, even with less oxygen.
You're selling it.
That's what we call human optimization.
Yeah, it sounds like the fountain of youth.
It's the holy grail. I mean, look, I say it's a foundational molecule. It's not a panacea, because it's not going to correct other deficiencies, right? If you're deficient in magnesium, you can supplement magnesium. If you're exposed to heavy metals, mycotoxins, other toxins, you still have to eliminate those toxins in order to optimize the body. But here's what I do know, that if you do all those other things, but without optimizing nitric oxide production, your body cannot and will not heal or be optimized. So we start with nitric oxide, and then we start addressing all these other issues, and people get better, without doubt. One of the beautiful things that I get to experience every morning when I wake up is hundreds of emails, texts, phone calls, messages of people who said we've changed their life. For the first time in years, men are telling me they wake up with an erection. For the first time in years, people are off prescription medication. Their blood pressure is now normal for the first time in 40 years. Their brain fog has gone away. I mean, the list goes on and on and on. And that's the beauty of nitric oxide. And that's the beauty of what we do, because if your body can't make it, we do it for you.
I can't imagine. Well, I can't imagine the satisfaction you'd get with people with flowery emails just saying, "Hey, you helped me out. I appreciate it." That's the highest calling. That's the best pay, knowing that your work helps others to achieve the measure of their creation, let's call it.
No, that's why I got into science and medicine, to leave a legacy, to make discoveries, understand the mechanism of disease to the extent that we could correct it and fix it. And I've been very fortunate and very blessed over the past 25 years to do that and experience it. But it doesn't come without people taking shots at you and people trying to destroy you personally, professionally, economically, emotionally, spiritually. I mean, there's evil out there that tries to take.
Have you caught serious resistance pitching nutraceuticals?
Yeah, I mean, as you said, from our competitors, my competitors don't like me talking about this because their products can't do what we do. And they can't do this because they don't have anybody in the company who's an actual scientist. These companies have these talking heads of cardiologists or scientists or whatever. They've never published a single paper in the research literature on nitric oxide. They don't know what they're talking about.
How old were you when you figured out or you kind of glommed onto this?
Well, I started in this field in the late 90s. A Nobel Prize was awarded in 1998. I was a first-year student at LSU School of Medicine in, 99 or 2000? When I was first introduced to science, I had a bachelor's degree in biochemistry from the University of Texas, and I'd spent a couple of years doing undergraduate research at UT Austin. But no, I was, late 20s, was it, when I first started in this field, and, very fortunate, trained under a really good mentor, collaborated with a lot of, talented physicians trying to solve some complex medical cases and, bringing that back to the lab, modeling it, and, we've made a lot of discoveries, and, I think it's changing the world, and it's going to continue to change.
What was the moment where you're like, this has legs, I can help people by telling them about this?
I've had a couple of kind of eureka moments or epiphanies in the research lab. Number one was when I realized I could actually make nitric oxide that I could detect, that I could put together components so that I could dial in any level of nitric oxide I wanted. So that was at least theoretically. And then I made this orally disintegrating tablet, found a manufacturer, he made it, brought it back to the lab, put it in my mouth, and I could release nitric oxide. And you could feel the vasodilatory effects, and we could document the vasodilatory effects. And then, for me personally, it came from my dad. My dad's a paraplegic, had a car accident in 1984. So he's been rolling around in a wheelchair for, 42 years, 41 years. But, as a 35-year-old young man, when I was 10 years old, Dad developed, he was obviously paraplegic, a T11 compression injury. But years rolling around in a wheelchair, being sedentary, he developed severe hypertension and diabetes. And again, going to all these doctors, they put him on all these medications, and I just realized there has to be a better way. So I started him on our nitric oxide and got him off all his prescription medication, overcame his diabetes. And then in 2014, he had a stage 4 bed sore, decubitus ulcer, that was non-healing. He developed sepsis, almost died. He was in the hospital for 10 days. Severe sepsis, and then he developed, a decubitus ulcer. We finally got him over the infection, and then all the wound care docs said we would never heal this wound because of his age, his paraplegia, his diabetes, all his comorbidities. And I just refused to accept that, so I started making a topical nitric oxide, treating that wound, and with our nitric oxide lozenge, kind of hitting that wound from the inside and out. And within 8 months, I healed a 4-year-old non-healing wound with nitric oxide. And I go, wow. And the wound care docs couldn't believe it either. They go, Nathan, we don't know what you're doing, but we've never seen this. in our decades of wound care. So then I go, okay, if we're seeing this effect on a 60-something-year-old paraplegic, diabetic, hypertensive patient, what is this going to do in the general population? And then the third one, the really big one, was a pediatric patient at Texas Children's Hospital in 2010. We started treating, had a very rare genetic disorder, a condition called arginine-succinic aciduria, or we call it ASA. But he had severe resistant hypertension. For 10 years, as a 5-year-old kid, started developing really severe blood pressure issues. And in February of 2010, he was, I think, a 13 or 14-year-old kid. And he was in the pediatric intensive care unit of a blood pressure of 215 over 110. And there was no medication that would bring his blood pressure down. So these physicians called me in. We started treating with our lozenge. Within 4 hours, his blood pressure was 130 over 80. When all prescription medication failed, this lozenge right here that releases nitric oxide gas normalizes blood pressure. And over the period of the following weeks, we got him off all prescription medication. We resolved his kidney disease within 5 days. He had, as a 14-year-old, he had twice the size of a normal 14-year-old. He had severe left ventricular hypertrophy. Within 5 months, his heart had completely remodeled, normal ejection fraction, normal dimensions. We completely reversed and resolved his heart disease in 5 months.
Wow.
Just with a law, we didn't change his genetics. We didn't fix his urea cycle disorder, his inborn metabolism. We just gave him nitric oxide and corrected every single one of his symptoms. And the entire medical community, PBS came and did a segment on us because we saved this kid's life when medicine had failed him. So that's when I felt pretty confident that what we were doing was going to change the world, and nobody else could do this. And we published that in American Journal of Human Genetics in 2011. So all this is documented.
Dude, the baddest of ass. Helping some kid who's just like down and it's looking bad, and you're like, hey, this is so simple. Nobody thinks it'll work, but I do. That's baller. That's so baller.
Now, and I can tell you, it was the most intimidating situation I've ever been in, because you walk into a room of probably 8 or 10 physicians at Texas Children's Hospital, Baylor College of Medicine, probably one of the top children's hospitals in the world, and they're looking at me like I've kind of ventured off the reservation. They go, we're the best docs in the world, and you're going to come in with this nitric oxide lozenge and do what we've not been able to do? And I go, take a seat, boys.
Watch this.
No, I was pretty confident, but, still, a little bit nervous that we were going to see an effect. But no, it was remarkable. And then they were like, wow, this is something.
That's the most I've smiled is stories about helping people help themselves. They're so complicated. You're like, yeah, I've simplified it. You guys have overthought this a bit.
No, that's right.
That's so cool.
No, and I tell people, nitric oxide fixes the physics problem of high blood pressure. Because if you remember back from high school physics, pressure equals volume times resistance. And we all have a finite amount of blood or volume of blood going through our pipes. And if we can't make nitric oxide, we got constricted blood vessels, so the resistance goes up, pressure goes up. If we give nitric oxide, we dilate the blood vessels, resistance goes down, pressure comes down. The volume doesn't change. And that's the beauty. So it's not, and this explains resistance.
Wait. So blood pressure is just your vessels are too small and constricted.
Yeah, it's the pressure.
I thought it was a liver thing.
No, look, there's multiple reasons for hypertension. It could be renin-angiotensin. That's why ACE inhibitors and ARBs can sometimes lower blood pressure. It can be dysregulation of calcium, and then calcium channel blockers can normalize blood pressure. But we know 50% of the people that are given these different classes of antihypertensive don't respond with better blood pressure. And the reason because their hypertension is not due to renin-angiotensin, it's not due to calcium imbalance or dysregulation. It's because it's a physics problem. Their blood vessels are chronically constricted, so now that same volume is in a smaller pipe, pressure has to go up.
Oh.
These are laws of physics. These are laws of...
That's why the heart gets bigger, because the heart's pushing through all these closed roadways.
Yeah, it has to increase its muscular mass because it's having to pump against higher pressure. It's called left ventricular hypertrophy.
Yeah.
So if you normalize blood pressure, the heart doesn't have to beat as hard, so it doesn't need all that muscle. And so you can normalize. We mobilize stem cells, we remodel the heart, and we're pumping against normal pressure now. So it's all connected, but it's all dependent upon adequate nitric oxide production.
All right. I don't do this very often, but I really want to make sure I understand the nitric oxide cycle. So if I'm eating beet pills, beet powder, or I got beets in my diet, but I do not have the enzyme to transfer it or translate it or re-up it,
The bacteria.
the bacteria.
The bacteria.
Can you supplement this bacteria?
Now, I filed a number of patents when we identified these years ago, but there's none of the commercial prebiotics or probiotics have any of these bacteria, or nothing that I've found commercially has been shown to affect these. That's why I had to develop the mouthwash or the toothpaste, and now we're developing a mouthwash that will launch in Q1 next year. That's a prebiotic that's going to help restore these bacteria. But first of all, you just have to get rid of fluoride in your drinking water, fluoride in your toothpaste. Stop using mouthwash, and stop eating high sugar things like beets or chews or gummies or soda waters or anything that leads to an increase in blood sugar. And now these bacteria can actually repopulate, and you create an environment and an ecology in the oral cavity that allows for the increase in diversity of the good bacteria.
I can get it from kissing other people, right? That's how most bacteria is transferred.
That's right. You got to find the partner with the right oral microbiome.
There's guys out there that do that. I know that. That's true. All right, tell me about your toothpaste. Oh, well, mouthwash first. So your mouthwash isn't going to quadruple my risk of diabetes like regular mouthwash does?
Now, look, first we'll start with the data. We know that using mouthwash, antiseptic mouthwash, all you got to do is listen to the commercials. This mouthwash kills 99.99% of the bacteria in your mouth. That's not a good thing, and I don't know why companies like Listerine are advertising this, because we know there's. Yeah, but here's the deal: you use mouthwash, you kill the bacteria, you decrease nitric oxide production, your blood pressure goes up. 2 out of 3 Americans wake up every morning and use mouthwash. 2 out of 3 Americans have an unsafe elevation in blood pressure. So the challenge is, and this is working with dental medicine professionals over the past 25 years too. And they come to me and they go, Nathan, if we have a patient with oral pathogens, the PGs, the really bad guys in the oral cavity, we have to use an antiseptic to kill the bacteria. I'm like, okay, fair enough. But the collateral damage that you're causing by throwing an atomic bomb in the mouth, killing everything, there has to be a better way. So what we recognize and what we discovered is that if you restore the production of the nitric oxide producing bacteria, it kills the pathogens. Because most pathogenic bacteria are sensitive to nitric oxide. Because nitric oxide binds to the iron sulfur centers of the bacteria, it shuts down their respiration. Where the good non-pathogenic commensal bacteria are nitric oxide producing. So I wanted to create a mouth rinse that selectively kills the pathogens, but improves the diversity of the non-pathogenic commensals. But then also creates an environment, an ecology that allows for the increase in population and numbers of these bacteria and increases salivary pH. Because if your saliva is too acidic, it creates an environment where these good bacteria can't proliferate. And it creates an environment where the pathogenic, opportunistic, caries-causing, gingivitis-causing, periodontal disease-causing bacteria start to populate. So I want to change the environment in the mouth. And the goal of the mouth rinse was create an environment that's not conducive to the pathogens and that's conducive to the improved diversity of the nitric oxide producing bacteria. So that took me about 5 to 6 years to finally put together the components that we could achieve. So that's coming in the next couple of months. But even before that, no, it's gonna revolutionize dental medicine. And what we're finding is, we published years ago, if you take normal intensive patients, you give them mouthwash, their blood pressure goes up. We documented that, we published that. Now what we're taking, if we take hypertensive patients, we give them our mouthwash or we switch them to our toothpaste for 30 days because we're targeting the oral microbiome, their blood pressure comes down. And think about this. Hypertension is the number one driver to the number one killer of men and women worldwide. And yet 50% of the people who take antihypertensive medications don't have better blood pressure. Simply by switching to our toothpaste, using our mouth rinse, we can improve the diversity of the microbiome, increase nitric oxide production, normalize blood pressure, and the public health implications of that are profound. We eliminate hypertension, the number one driver, the number one killer of men and women worldwide.
Dude, I'm rooting for you. That is a big statement that my toothpaste is going to help a lot of people manage their blood pressure.
Yeah, as we know, systemic health begins in the mouth. I mean, we've known that for decades.
You and I have been to a lot of dental conferences talking about heart disease, and dentists are strangely passionate about it, or rightfully passionate.
Now, I think Dentists are the most important health practitioners on earth. They can be your best friend or your worst enemy. Because I've seen dentists cure ALS, autoimmune disease. But I've also seen dentists cause ALS, cause autoimmune disease, by doing root canals, by doing fluoride rinses, by destroying the oral microbiome.
All right, so what's in your toothpaste?
Toothpaste, we use a hydroxyapatite base because, number one, we want to remineralize the teeth. We want to strengthen the teeth. We eliminate fluoride for the obvious reasons. And then we also wanted to put things in there that we knew would repopulate the good bacteria, that would elevate and optimize salivary pH to create an environment where these good bacteria could actually live and thrive. And then we put some, because obviously you want to be left with a fresh breath and a clean feeling mouth. So we put certain essential oils in there. I think it's a spearmint base, so it's leaving your breath fresh, mini fresh, clean feeling. And it's an incredible toothpaste. And the best example was I hadn't been to my dentist in more than 3 years. But I'd been using my toothpaste for about 3 months at the time, and I probably been a couple of months now. Went to my dentist for a routine checkup. They go, Nathan, it looks like we did a cleaning yesterday, and you haven't been here in 3 years. I had 0 tartar buildup. My bacterial load was a 1, the lowest on the scale. And they go, I guess come back in 3 years. Do whatever you're doing is working. Just keep doing it. And then we've had other people do the same thing. Go to their dentist and they go, what have you done since last year? Because this is your best dental visit in 40 years. And they go, well, I switched to this Cardio Smile toothpaste. And they go, what's in it? And we've got dozens, probably hundreds now of case reports like that. And that's just the toothpaste.
So you're not promising it'll cure everybody, but for a select few of the population, it's just what the doctor did not order because he didn't know about it, but it's what you need.
And that's our goal, is to change the conversation to eradicate cardiovascular disease by focusing on safe and effective nitric oxide product technology and lifestyle changes and oral hygienic products that basically, we call everything we do restorative physiology. We're a biotech company. We've got drugs we're developing for heart disease, Alzheimer's, and topical drugs for diabetic ulcers, but we're not a pharmaceutical company because we don't employ pharmaceuticals or pharmacology. We give back what the body's missing, and this is restorative physiology. Years ago, medicine was applied physiology. Today, it's applied pharmacology, and it doesn't work. It's obvious it doesn't work. We have to get back to the basics. So everything we do is called restorative physiology. And that's my goal, that's my mission, is to eradicate cardiovascular disease through the proper education and awareness of nitric oxide and employing these simple diet, lifestyle, oral hygienic practices that optimize nitric oxide production. And it's really that simple.
Can I make an observation with you? My dad was he was a salesman, and he sold law books to lawyers in the 70s, 80s, 90s. Right, internet came and that industry is no more, but he sold law books to lawyers. And I always thought that was fascinating and that was a whole thing. Oh crap, where am I going with this? This is a good. Oh, so back in the day, a lawyer, to grow his business, he could not put an ad in the yellow pages. He could not get a billboard. To be a lawyer or a doctor, you had to work for someone else, work really hard and build up your book of business. And then maybe you break off or you join a group or something. But somewhere around the 1990s, medicine started advertising, and it was stuff that we thought, I don't need that, plastic surgery, or, stuff that certain time and place of life, yeah, you want it. And a couple of years ago, I'm driving through Dallas and I was amazed at all the medical and lawyer billboards. And, I remember my dad telling me how these lawyers, they want to get going on their business, but they can't advertise and it's really slow growing it. And now you're describing a world in which not only are we past that and it's a business and we're not 100% sure on the information we're getting from the pharmaceutical companies, but they're ruthlessly advertising. They're catching people in traps of bad therapies. And even if you assume everybody has the best intentions, it's not working out that way. But the world has changed a lot in the last 50 years, where it was tacky and illegal for a lawyer or doctor to advertise. And now that's all you're getting from medicine. It's not so much about helping people help themselves, helping others help. It's now about what can I get from this person in this sickly state?
Look, all you have to do is in a 45-second pharmaceutical commercial, listen to the 30 seconds of disclosures. Nobody with an object mind, with any sense of objectivity, would ever take that drug if they just simply listened to the disclosures that they're legally required to state. This could cause blindness, death. I mean, if listen to it, people pay attention. Don't pay attention to the headlines. Listen to the disclosures. And nobody.
Do you remember Olestra and the anal seepage? And we're like, what are we doing? Why is this on the market?
They're very good at marketing. I mean, I got to give it to them. And a lot of these companies out there are very good at marketing. In fact, they're led by marketing executives, not scientists. And again, that's what differentiates me. I would never advocate. I've had people come in. I don't have no formal business training, and my competitors criticize that. But here's what I do. I will never abdicate my position as CEO and chairman of my companies to someone who's not a scientist because they don't understand. We're driven by science. We lead with science. And these other people who are marketing executives, former tech executives, their whole motivation is how do we make more money? And what we do, the product technology is going to be more expensive. You can find my product may be sitting next to a product you can buy for $5 because they're not interested in science. They're interested in making money and selling you something that's going to make the company money. So that's the difference between what we do is I'm led by the science. I lead the companies. I make the decisions. I develop the product technology, and I'm not driven by marketing. I'm driven by science.
For the audience, when he says science, he's meaning truth. He wants to bring the truth. He wants, as close as we can find it. Science is adjacent to the truth because we're trying to get right to it, but there's so much nebulousness, so much confusion that there's been a lot of hijinks in the past. And when the sales guys get in charge of the science, it becomes truthy, science-y.
Yeah, these companies out there claim they have science, built on science, but yet they're putting products out there that have zero science. In fact, it goes against the real science. And so what I try to do is, there's information out there, information overload, but there's also misinformation. The challenge for people who are not in science, who don't have a science background, is how do they interpret the data? And then how do you, impart that information into knowledge? Because really that's the end of the day is we want knowledge. We don't want information because people take information, misinterpret the data, then it's misinformation. I want to take information based on real science and impart knowledge and education and wisdom to the consumer. Yeah, principles, because it's got to be based on science. And then I see these podcasts with these CEOs of so-called nitric oxide companies out there saying they want to, building science, but they're producing products that are absolute bullshit. And I've proven they're bullshit. And they don't like it.
No, but nobody knows the truth because it's all about marketing budgets. It's really hard. So are you going to be going to the dental conferences this year, pushing the toothpaste?
I do. I speak at probably 6 or 8 dental conferences. In fact, this weekend in Houston, I'm headlining a dental event in Houston. But we're finally getting last year I spoke at the American Dental Association in Chicago. We're finally bending the ear of the policymakers and the people who set the standard of care and, bringing to their attention that what they're doing, whether intended or not intentional, is causing a lot of harm in patients. And so the science is clear and we got to do better. So we're finally getting their attention.
Now, you go to a lot of conferences like I do, and this is an observation, a little bit off topic, and we're talking about the industry. Let's say I go to a heart attack and stroke prevention conference. If it's a private one put on by smaller people, not big corporations, they really get into the science and they kind of come up with their own narrative. They pull from a lot of different sources. But what's interesting to me is that other conferences, they're not even talking about corn syrup and seed oils yet. These are prevention conferences. And I cannot figure out what's going on there. Do you have any insight onto that you can help me figure this out?
Well, it's just like anything. There are early adopters and then there are late adopters. And it happens in any industry. I think the really progressive early adopters and people who recognize the adverse consequences of seed oils, high carbohydrate, high sugar diets are the early adopters who basically try to get away from that and teach that. Where these others, it takes a little bit longer. And obviously, the bigger the organization, the more risk management becomes the leading way, right? Because in any big company, it's always risk management. And so I think you have to slowly implement these changes or these new concepts in these larger organizations. But it's the early adopters, it's the pioneers, the innovators, the people who see this early, who start the change, who start the conversation. And then it takes a couple of years, and these other big organizations that reach a bigger audience start to implement it, start to catch on. It's just a process. I think.
I think you're right, but I suspect some foul play at some level because in the year 2024, not talking about sugar and seed oils at a prevention conference, it makes me think there's a narrative that they're pushing because that seems like so 2010 to cut out sugar and all that.
Well, think about this. Think about this. There's fads, right, in every industry, even the supplement industry. And there's these form factors of deliveries. 20 years ago it was all powders and pills. And then it became ready to drink liquids, RTDs. And now, over the past 5 to 6 years, it's chews and gummies. People putting creatine in chews or gummies. What are chews or gummies? It's sugar and seed oil. That is what a chew is. That's how this form factor.
I thought it was cow hoofs, the gummies.
I don't know what it's. See, look at the back of it.
It's not natural. I think we can agree on that.
It's seed oil and sugar, and people are taking this and getting their vitamins in the form of chews or gummies. And why are we doing this? It makes no sense because you have to continue. These companies have to continue to innovate. How do I make this different? Well, let's put it in a different form factor. Because beet powder is not sexy anymore. Let's put it in a gummy. Creatine powder is not sexy anymore. Let's put creatine in a chew or a gummy. Vitamin C is not sexy anymore in a powder or a pill. Let's put it in a chew or a gummy. But it makes no sense to me, and it's one of the most frustrating things that I deal with. But it's these fads, and I think it's not doing anybody any good.
Yeah.
So let's just get back to the basics. We don't have to be sexy. Sometimes science isn't sexy, but it gets to the core of the problem.
You got me thinking about it. You're right. The gummies and all that, it's all about convenience and it goes and whatever. But man, if you had a good cook in your house that made real food, you can avoid a lot of this.
No, that's right. That's exactly right.
All right, man. We've wasted a whole hour together. I really appreciate it. I will see you at A4M next week. I'm dying to try those little gummy release that you just did. That's super interesting.
No, please don't call our products gummies, Joe. If there's one thing take away from this, we do not make gummies. Yeah, no, it's gonna be fun. We'll have a good time.
All right, man.
All right, see you. Thanks.
Be well.